Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
Next is the superficial temporal region. Okay. Hope you are able to see my screen. So we will study the lateral side of the skull. So this is what you are seeing in the lateral side of the skull. So it can be divided into two. That is temporal fossa and lower temporal fossa. So these two fossas are separated by a structure that is zygomatic arch. You are able to see the zygomatic arch in this picture. This is the zygomatic arch. So by the help of zygomatic arch, it is divided into supratemporal fossa and the infratemporal fossa, or temporal fossa and the infratemporal fossa. Alright. So temporal fossa is a fan-shaped space which is present on the lateral side of the skull above your zygomatic arch. So what are the boundaries? Can you tell me the boundaries of temporal fossa? Now you understood which space is known as temporal fossa, right? So what are the boundaries? Down anyway, which is the partition? Zygomatic arch. So inferiorly by the zygomatic arch. Correct, no? So it is continuous with the infratemporal fossa, which is deep to the zygomatic arch. And superiorly and posteriorly by the temporal lines. Narisha?
Yes, ma'am.
See, this is what I am telling. Inferiorly by the zygomatic arch, and superiorly and posteriorly by the temporal lines. These are the temporal lines. Superior temporal line, inferior temporal line. All right?
Yes, ma'am.
Okay. Anteriorly by the frontal process of the zygomatic bone and posterior process of the zygomatic process of the frontal bone. You see the picture. See, this is the anteriorly. So here you can see the frontal process of the zygomatic bone. Okay. All right. So laterally by the temporal fascia. So temporalis muscle is there. So the fascia which is covering the temporalis muscle. Okay. See, this is your temporal fossa and this is the infratemporal fossa down. So this is the zygomatic arch. Okay. Clear?
Okay.
How
Yes,
the zygomatic arch is formed? Zygomatic process of the temporal bone and the temporal process of the zygomatic bone together forming the zygomatic arch. Clear?
Yes, ma'am.
This place is covered by a temporalis muscle, which is covered by a temporalis fascia. Okay, so this is the temporal fascia, the white colored one.
Okay, ma'am.
Okay, next about the floor. Floor, I told you, it is formed by the top by the frontal and parietal bone and the sphenoid and squamous temporal bone inferiorly, and all the four bones to meet a point, that is the pterion. So it is an important landmark because the middle meningeal artery, anterior batch of the middle meningeal artery and lateral fissure of the cerebral hemisphere. So both are located there. So that is an important landmark. And pterion corresponds to the sphenoidal fontanelle of the baby's neonatal skull. So that closes in the 3rd month after birth. Okay, so that is the importance of pterion. See here you can see a meeting point, H-shaped suture. That is the pterion. Okay, so cerebral hemisphere is there plus middle meningeal artery is there. Okay, so that is the clinical important. And what is the meeting point? Frontal bone, parietal bone, temporal bone, sphenoid bone. All these bones are meeting in a H-shaped suture. Okay, so next about the temporal line. Okay, so I've already studied there are two temporal lines, superior and inferior temporal line. So which will cross the skull from the zygomatic process of the frontal bone to the supramastoid crest of the temporal bone. And superior temporal line gives attachments to temporal fascia. Inferior temporal line gives attachment. See, the superior one will give to temporal fascia. The inferior one gives to the temporalis muscle. Okay. Then what are the contents of this temporal fossa? Temporalis muscle, zygomatico-temporal nerves, deep temporal nerves, deep temporal artery. So can you summarize the temporal fossa? What you understood, where it is seeing temporal fossa?
You mean boundaries, ma'am?
Yes. Boundaries, and you tell me what you understood about the temporal fossa. Lateral side of the skull is divided into, by the zygomatic arch, it is divided into temporal fossa and infratemporal fossa. Temporal fossa is the area on the side of the cranium from which the temporal muscle arises. Correct? No?
Yes, ma'am.
Then you tell me.
And the boundaries inferiorly by a zygomatic arch, and superiorly and posteriorly by temporal lines, and laterally by temporal fascia, and anteriorly by frontal process of the zygomatic bone, ma'am.
Okay.
And temporal lines, two superior and inferior temporal lines, superior attached to the temporal fascia, and inferior attached to the temporalis muscle, ma'am.
Okay.